you like to start?
Sure. Okay, good afternoon, everyone. I'm Susie Perino, and I'm honored to be serving as General Chair of the 2023 annual PIL campaign called Memories Matter Too. This campaign is very near and dear to my family because our mom suffered from dementia before she passed last November, and I know many of you have had similar experiences. Welcome to the volunteer training. It is because of volunteers like you that year in and year out, we are able to positively impact between our over 30,000 children and adults through the Foundation's many programs. At this time, I would like to ask if each of you would please introduce yourself and tell which division that you're helping with. And we can start with our division chairs. So I am Susie, and I am helping with the community division. How about Larry and Vicki?
I'm Vicki Cooper, and I'm on the business division co-chair with
Larry Cooper.
And Sarah?
I'm Sarah Willie, and I'm working with the clubs division.
Thank you. Eric?
I'm Eric Coons. I'm working with the medical division for the second year here.
Thank you. Is that everyone? I think that's everyone, right?
For the chair.
Okay. For the chairs. Okay. So, Kay, would you like to go next? Ooh. Can't hear you. No.
You're
Okay.
not on mute, so let me see if I can ask you to unmute. Does that help? Try again. No, okay, that's all right. So we have
Okay.
Kay Fisher with the community division, and she's been helping us before.
Thank you. Diane?
Diane Bracken, and I've helped a lot through the years. I guess I'm part of the community division.
Okay. It looks, I have a different name, but that looks like John to me. Am I right?
Yes. I don't know how that name got up there.
Okay.
I'm
John, which John or Dean in place of Kevin Foley? I thought that was a little strange.
Yeah. I'm with the business division.
Thank you. Martha?
I'm with the club division.
Okay. And we have the phone number, 816-527. Okay. How about Kim? Are you
Hello,
there?
how are you? Yes, can you hear me?
Yes.
Is this Dr. Cutter? I'm hearing two people. Is
Okay.
that you, Dr. Cutter, trying to talk?
I think it was maybe Tim Dieterman.
Oh,
Oh,
Is that you,
Okay.
Tim?
It is, yes.
Yeah, okay.
which number are you on? 816-527 or the
Nope, 556.
He's the
you're
563.
the 563? Okay.
Yeah.
All right. And tell what division you're on.
I'm in the business.
you might need to help me here, Joan. Who else do
Okay,
we?
then we have P. Joseph, Dr. Joseph. Can you mute and just tell us what division?
Maybe, let's see.
Yep.
No. Neurology division.
And she's helping Eric, and we're really glad to have her on board. And then Ann Henderson. Can you unmute and tell what division you're in? Maybe not. Ann's helped us for many years. She's in our community division. And then we still have the person whose number is 816-527.
I want I want to say that was Patty Sword. And if
Oh,
it is, she's business. I
okay,
think that's who it was when I saw a quick glance.
okay. So Patty Sword is our number 816-527, and there's Ann. We see Ann with community. And now we have Debbie Springman coming on. We'll give her a second. And did you say John Kirkhoff is on? Did I hear that?
He was gonna be, but I don't see him.
Okay.
yet.
Okay, so we've got a full house. We're just missing one person. This is great.
Okay.
Debbie, we just introduced everyone. Is there a way you can unmute and tell everyone hello? Debbie Springman?
I finally got in.
All right.
Did you hear me?
We can hear you. We just don't see you.
Okay, that's fine.
That's okay. There we are.
There we go.
You got to help her.
Yeah.
So Debbie is helping with
Thank
the business division. And thank you, everyone. This is wonderful to have all of you here.
This amazing boost for our area communities couldn't happen without each of you. There will be approximately 60 of you making phone calls to prospective donors. Multiply each of your efforts times that amount, and it's a great wave of commitment and support that is conveyed to our donors. We thank all of you for joining us. This is very important work. Each of you should have your campaign folder that contains an agenda. Joan is holding up the folder there. All right, so is Ann. Okay, and it'll also have a script for today's PowerPoint so that you can follow along either in your book or on the screen, as well as other information about making your calls and the programs that the foundation funds. It will help to refer to this throughout the training.
Here's where the script is, in the middle section. Okay. And the rest of that is what is in there in the front. On your left-hand side is literature that your donors will be receiving. The first couple items are the campaign booklet, the pledge card, the letterhead, and a sample of the outside envelope, as well as an article from our health lines. We'll be learning more about this. It's our annual report. Vicki will talk about that later in the recording. And then this is a helpful sheet for you when you're making your calls. It lists all of our programs that we're funding that actually have contact people to call to help others get signed up to receive those services. And then this is a listing of our dementia caregiver support groups in the area that we have helped do. So that's all on the left hand. And we'll talk more about the right hand later on during the meeting. Susie? Oh, wait, I'm sorry. I need to share. I need to share the screen. Here we go.
There we go.
Can everybody see it?
Then we're ready for.
How's that? Does everyone see it?
Mm-hmm.
Okay.
Yeah. Right. We'd like to, and I think we're on, there we go. Okay.
Here we go.
There we go. Okay. We'd like to honor the late Betty and Hugh Miller for being the spark to initiate the Dementia Project. Betty, who is Joan Hermas's mom, lived with dementia for 11 years until her death in 2020. Hugh passed in June 2021, and it was one of his last wishes that he and Betty wanted to somehow help improve dementia services in our area. They left a bequest to the foundation that fall with the request that it be used to jumpstart a dementia initiative. So here we are, and look at all we have accomplished already. We greatly exceeded our $475,000 goal last year, reaching nearly $562,000, which allows the foundation to help more people. This year's goal has been set at $550,000, and that includes funds for the new Dementia Navigator. The campaign year actually runs from May 1, a month ago, to next April 30th, 2024, which is the end of our fiscal year. Our main concentration as volunteers for making calls will be mid-summer to fall. Our medical division chair is Dr. Eric Coons for the second year. He is a general practitioner at CGH, a former foundation trustee, has been overall chair of the campaign previously, and has also been on the medical division committee many years. Eric?
All right, hi, and if I'm a little distracted here, I have a very ambitious fly in my office that's made it up to the third floor and seems bound and determined to land on my face. So if I'm swatting at that, just don't mind me. Anyway, the project really resonates with me because my own mother, Beata, she unfortunately struggled at a young age, despite being otherwise very healthy. It was really her only medical problem. What I really saw and experienced is just how hard that was on the caregivers and family. Mom would try and get out and run away, and she was very fit and could outrun, my sister and my dad, and hop over fences at nursing homes. So it was a really tough thing to see. And her baseline disposition was that of an extremely positive person, could by force of will just make any situation seem better. And yet that changed a lot with dementia. And it's a very cruel thing at times, and it really gave me a lot of empathy for my patients and caregivers who are going through that. So I've been thrilled in this last year to have the opportunity to start to engage our dementia navigator to get more resources and help for our patients and families that are really struggling. And I think that's maybe part of the reason we were successful and went over our goal, is that this does really resonate. It's a growing problem nationally, not only in Sterling, but we are locally doing something, and I think something very proactive about that. So, okay, well, if you're following along in slides 6 and 7, we're going to talk a little bit about dementia. It's not a normal part of aging. Sometimes having a little more trouble with memory is, but dementia is a whole step beyond that for sure, and causes its own whole set of problems and can affect people in very different ways. Every 65 seconds, someone is diagnosed with dementia, and there's almost 6 million Americans with dementia by now, and by 2050, there's estimated to be 14 million. And unfortunately, we don't have something on the horizon that's really game-changing in terms of treatment from a medical perspective. So I think we're going to have to deal with the fallout and the management of this for some time. So I think the role of the foundation here is going to be large for the foreseeable future. 80% of the care of people with dementia is delivered by family and friends. So they really take the brunt and the burden of that. And sometimes, if that pool of people is small, it can be very difficult, especially if their family is out of town, they're not able to help as much. They may not even know how bad things have gotten, because their memory is still the last time that they were with, mom or dad, and things may have been very different. 2/3 of the cases are women. That's mostly driven by the fact that men do more stupid things and don't live as long. I was told at one of my conferences that the best way to avoid getting dementia is to die young, and men are better at that. So dementia is more prevalent in women. But it obviously can affect both. There are 3 stages. There's early, mild to moderate, and then late and severe. And these are set by clinical criteria that Dr. Joseph went through in her talk last year, and can be looked up as well if you're interested, but it's just stages of the clinical progression. Age is the greatest risk factor. Risk doubles every 5 years after age 65. And while there are lots of things that can help, and they're certainly worthwhile, I kind of liken it to driving well. A very good driver tends to get in less accidents. Their insurance rates are better, but the accidents are still possible. They still have to buy insurance. And my mother was a good example of someone who grew her own garden, did all the right things, kept herself very fit, had no family history, and yet still ended up. So there's still some things we don't understand, but it's still worthwhile trying to be a good driver, so to speak, doing the right things so your risk of an accident is at least less. And exercise and diet and cognitive thinking games and skills and keeping yourself socially engaged, those are all important. They had a study on nuns, and a lot of the nuns, by staying very active and engaged late in life, had significantly lower levels of dementia. So all worthwhile doing, but unfortunately not quite definitive. And with that, I think I'll turn it over to Larry here. Larry and Vicky.
Larry? Go ahead.
Go ahead, or?
Okay, I'll just tell a little bit about you real quick here, okay?
Okay.
Okay, Larry and Vicky Cooper are business division co-chairs. Larry is a Thrivent financial representative, and Vicky has been his office assistant for many years. They have seen firsthand the impact of dementia in their professional and personal lives. Okay, Vicky.
We have been so inspired by the new dementia program and are happy to serve as the business division chairs for this year's drive. Last year, Larry and I volunteered for the first time on the community division committee, and it was a real eye-opener for us. Nearly everyone we spoke with had been impacted by dementia in one way or another.
Over the past 4 decades of my career in financial planning, I've developed a much more pragmatic approach to and an opinion about dementia through the eyes of my clients. Dementia is seen as one of the most significant problems they feel can derail plans for a successful and happy retirement. Vicki and I have vicariously witnessed hundreds of these financial scenarios unfold, and some of them tragically. But more and more, we found ourselves being drawn into the realization of this destructive, cruel, silent killer. And the impact was just way more than economic. It was absolutely life-altering for everyone concerned. My parents lived into their early 90s. Initially, my siblings and I were somewhat in denial and wanted to attribute our mother's advancing senility to her poor hearing. But as time progressed, however, her behavior became much more erratic and temperamental. We found ourselves at our wits' end as we struggled to provide the kinds of care that she required. We even felt like we were letting her down when we had to call for outside assistance. It truly proved to be a very difficult time for my entire family. And now we want you and everyone else to know about this CGH Healthcare Foundation's battle against dementia, and that there are knowledgeable professional people who understand and care, along with a plethora of programs to provide the many levels of assistance, and to let you know that our community and you are not alone in this battle.
Thank you. Sarah Willie is Club's division chair. She is a retired school superintendent from various area schools and currently works as an educational consultant with the American Institute for Research. She has been a member of the committee for several years. Sarah?
Thank you, Susie. Within my own extended family, I've witnessed the really sad detachment that dementia brings in several of my aunts, uncles, and in my mother, although she was never formally diagnosed and lived to be 92. When my Aunt Betty Miller was diagnosed, I realized how well she had been hiding her slow decline in memory and awareness. And one particular time sticks out in my mind because I found out afterward what explained her behavior. She greeted me with a general comment, "It's been so long since we've seen you. It's so nice to see you," but didn't call me by name. I'm sure had no idea who I was, really. She knew me, but she really wasn't aware. So she had really hidden her slow decline in memory and awareness very well. After Aunt Betty's death, my uncle, Hugh Miller, gifted a bequest to the CGH Foundation in her honor, which planted the seeds that started this new dementia project. I was honored to be asked by my cousin Joan Hermes to chair the club's division for this year's campaign. Of course, I said yes, and I'm looking forward to helping spread the word about dementia and the impact it has on area families. Another couple of people that I know are Janice Repass and her son Dugan Repass, who are both CGH employees and division co-chairs of the CGH employee division. Janice and Dugan, her son, knew all too well about how hard it was to care for someone with dementia because they had to deal with it with Janice's mother. Janice is a gastroenterology assistant and Dugan is a physical therapist. They lost Janice's mom, Phyllis Lenman Powers, in 2002, who lived with dementia for years. Janice said her mom lived her life in the moment and didn't let it keep her from going out and being around people. At the time, they wished their family had better resources to learn about dementia and about how to be more prepared for her daily care. Dugan said it was hard to watch his mom go through both the physical and the mental stress of caring for his grandmother. The family chose the foundation as the recipient of her memorial then, so others could benefit in having more resources available. During the past year, the foundation took the step of hiring a new dementia navigator, Beth Stirk, who you'll learn a little bit more about later. They held a community forum at Bethel Church, which featured CGH neurologist Dr. Preeti Joseph.
Who we have with us today, listening,
Yes,
taking
who is
part.
here.
So we thank her so much.
She was the main speaker, and I attended that presentation. It was very good. She addressed what dementia is, the different types and treatments, and 100 people attended that session. Last fall, the foundation presented 3 workshops on legal, financial, and care planning associated with someone with dementia. There were panels of about 6 to 8 professionals, and between the 3 workshops, there were 150 in attendance. Area law enforcement, ambulance crews, and fire departments also took part in an online dementia interactive training session to help them understand how to approach and communicate with individuals they encounter who might have dementia. And with that, I will turn it back to Dr. Coons.
Okay, as you see up on the screen there, Beth Stirk is our new dementia navigator. The foundation has in the past and currently does fund a breast health navigator and an oncology case coordinators. They've been very helpful for kind of connecting the patients to resources and making them feel very individually cared for and putting the community in our community hospital. When we were trying to think about what we could do to help with dementia care, one of the big holes that we saw is just trying to put together all the disparate resources that are scattered throughout many different places and facilities, and trying to get things back on the road after COVID, because so many of these things got canceled or limited with COVID restrictions. So we decided that a dementia navigator would be helpful. We were fortunate to have Beth apply. She has been fantastic. She's already helped over 30 families just since March. I know I've probably referred 10 or more families myself, and have had some really great results. Her first day was just March 27th, and she's already getting to be well known for being a really go-getting and helpful person, just the type of personality we really need for people struggling with dementia and the families. I really love that this is available to everyone, whether you're a CGH patient or not. You may just be a not just, you may be a family member, you may be dementia patient somewhere else. If we can help, there's no paperwork, no red tape. We have, it's very nice to tell families we have somebody there in place to help them and answer their questions and get them connected to respite care or support groups or funding for home care sometimes. She's been able to do that with a few patients, which is amazing and wonderful. In addition, in partnership with the Alzheimer's Association, we've assisted in creating a caregiver support group in 7 different towns, in Sterling, Polo, Chadwick, Morrison, Mount Morris, Prophetstown, and Dixon. These have been very well received. I had a patient that, as an anecdote, was very concerned about being able to get back to her support group when she was on isolation. It was more important than work or any of her other commitments. She felt her people were there, and she really wanted to get back to that, and we were able to make that work out. So people are really bonding and feeling supported by those groups. Also, in addition to that, we had an Alzheimer's Association representative or a representative from a foundation present 3 programs for CGH staff, as well as pastors breakfast, speaking at the community forum, conducted staff trainings at 2 area healthcare facilities, and also provided assistance at 6 area club meetings. This is a wonderful association, have many good resources to help on the website alz.org. And I would second that. Boy, there's even an ability to schedule a one-on-one counseling with a master's trained behavioral specialist that can help people go through difficult problems. And I've had people call in crisis with a family member really struggling, and they were able to use tools and tips from that to get through that. So another really helpful resource that we can share and spread the word and make life just a little less difficult for patients and families dealing with dementia. So with that, we'll turn it over back to Susie.
Thank you, Eric. This past Sunday, June 11th, we hosted our second Memories Matter 2 walk at Westwood in honor of all those individuals and families affected by dementia. There were 125 adults and kids attending, and it was a wonderful outpouring of love, friendship, and a celebration of those individuals and families impacted by dementia. This past year, the foundation provided sensory therapy items for 5 area nursing facilities for therapy sessions with those residents with dementia. We just finished hosting a 9-week Lifescape stress busting class for 20 dementia caregivers, and also offered a dementia therapies program on June 7th, presented by the CGH Rehab Services Speech, Physical, and Occupational Therapy Specialists. As was done last year, we will continue to fund a public awareness campaign as well.
And
Now I'll
Dr.
turn it over
Joseph,
to Vicki.
well,
Sorry.
just a second, Dr. Joseph, forgive me, but I can't help but be thinking as you're sitting here listening to all of this, that you might have a few words to share with everyone about how our initiative has impacted your practice, because that's what you do. You work with our dementia families. Would you care to share a few words?
Am I up?
No, it's asking for Dr. Joseph.
You're still on mute. Or maybe she's not right there this instant.
Mhm.
Well, let's go on. Vicki?
Each fiscal year, the foundation provides a summary of the number of children and adults who were impacted through our programs. It shows from May 2022 through April 2023, there were 32,600 Sauk Valley residents touched by the foundation, including 9,400 educated, 22,400 were assisted with free to low-cost health services like mammograms, eyeglasses, medication, and transportation, and 82 were screened for cholesterol, blood pressure, and diabetes. And as Susie mentioned before, the total funds raised were an astonishing $561,728. More than $500,000, I think, is so incredibly impressive. The report also promotes the valuable programs for the coming year.
As we continue with slide 16, I'll digress a little bit because if you're new to this particular fundraising initiative or a repeat volunteer, these are some important topics for you to familiarize yourself with. The remaining projects have been in existence for multiple years. Here's what we can offer as long as we raise this necessary funding. Ways to wellness. Staff offer expert assessment, brief targeted intervention, and individual therapy for social, emotional, and environmental issues. Therapists can assist in finding transportation or housing and help file for Medicaid. Again, I'll digress because this is a big deal. Medicare doesn't provide any benefits typically for dementia-related care. And this idea of Medicaid, that's only available when institutionalized and having exhausted most of the patient's assets. So really the burden falls back on the shoulders of other basically unprofessional caregivers, meaning family and outside assistance. Think about this next bullet point, pediatric mental health. With all the social upheaval in the news today, from gender identity to mass violence, we're vividly aware that our young people need guidance and positive influences more than ever, whenever, and wherever. In 2017, the foundation began funding the PEDS mental health program. Sinisippi Center's mental health professionals meet at area schools with students, teachers, parents, and administrators through a partnership with the foundation. The increased communication between parents, staff, and counselors produces much better monitoring and positive outcomes. Having the professionals at the school opens up direct communication between the student, teacher, the counselor, the social worker, and everyone involved, and keeps the entire team informed of the students and their social and emotional health. Participating schools include Sterling, Rock Falls, Fulton, Polo, Chadwick, Milledgeville, Amboy, West Carroll, and Eastland. Oncology case coordinator. This position was created 2 years ago, and the individual provides the resource assistance to all cancer patients, helping them to overcome the non-medical obstacles that might be getting in the way of their overall health and improvement, and helping them get referred for nutrition and physical therapy and other ways to wellness assistance. Eyeglasses for kids and adults. In the early days, we assisted over 150 children with a free pair of eyeglasses and exam. We now help about 40 per year. 6 years ago, we added adults to the program and assist about that same number to the adults. Nutrition and fitness, the CATCH program. The foundation partners with the Sterling Rock Falls Family YMCA to fund the staff who go into the schools in Sterling and Rock Falls to teach them about nutritional lessons and to lead activity sessions with the students. Sauk Valley Community College nursing students have also helped with putting on skits to teach about eating healthy. Students, teachers, administrators, cafeteria, and maintenance staff, and parents all get involved. They're included in learning more about leading healthier lives. The Prescott Dental Clinic. We provide $30,000 each year for the dental clinic housed at the Whiteside County Health Department. serves nearly 8,000 patients last year, with almost 11,000 visits. We have partnered with them since 1996, providing funds for supplies needed for this very important service to our community. And if you do the math, that's over $700,000. It's an incredible figure. Now back to Dr. Coons.
Well, thanks. We got more projects yet. First one I'd like to talk about is cancer comfort care. And I'd like to point out that this is more than just, window dressing and making nice. There's good data to show that people who feel better, have a better outlook, have better outcomes. They do better. There is a mental aspect to surviving chemotherapy and getting better as well. So these things make a very significant impact. Things like comfort bags, where they're given out and they hold treats and amenities and gas cards and meal cards, lotions, mint tea, and other items just meant to smooth that journey a little bit and to make people feel cared for, not just treated. Medication assistance is another program. People run into trouble where they get into the donut hole on their Medicare coverage, or there's some other interruption in coverage and they have medications that they very much need but can't get. The foundation can help with a 30-day supply of prescriptions given to people who can't afford their medications for chronic medications. We can, let me rephrase that. For chronic medications, we can sometimes help sign them up for national suppliers and get them into a needy med program or a medication assistance thing from the manufacturer as well to help more long-term. Last year, we helped 50 people in that way. Women's Health now covers the cost of mammograms, diagnostic screenings, ultrasounds, and MRIs for area women, helping 611 women and 5 men in this past fiscal year. Nobody has to worry about being able to afford cancer screening in our area, and that's a wonderful thing. And that includes the MRIs, which were sometimes a problem. There were people who were high risk and would have liked to have gotten an MRI, but were unable to afford one. And now we can help out with that. So,
Can you
really
talk about transportation too?
Oh, yes. So yeah, with transportation, people have to get to care to be able to get the help that they need. And there are people who can't afford it or have some other barrier to getting not only to us, but to other specialists. And we've are able to provide transportation assistance in and out of town and assisted nearly 600 patients in the last year in that way. Cardiac and workplace wellness. This is an old program that we've fostered for quite some time, and it's really helpful. I'm dear to my heart as a primary care physician, trying to get people to stay healthy in terms of educational programming, cholesterol screenings, blood pressure and blood sugar screenings, flu shots in the community and in area businesses, making things easy for people to get the care that keeps them out of trouble to begin with. The next program is the therapy dog program. Really happy to see the pooches back in or the hounds in the hospital, as I like to put it, because they also in a similar way help improve outcomes through the endorphins that we release from being able to have a friendly dog and something that takes our mind off of the issues that we're dealing with in the hospital. So just over 200 patients were visited by the dog teams. Nearly 400 visitors and staff were also treated to a greeting. There are just 4 dogs currently on the program. We are looking for new dogs and teams for our patients. Dogs must be at least a year old, able to pass temperament testing to be considered and know some basic commands. The next is pulmonary rehabilitation. Therapy sessions are covered for patients who can't afford the weekly therapy recommended by those with breathing issues. COPD is another issue that sometimes doesn't have the greatest medical treatments, but teaching people and strengthening them to move those stiff lungs can make them better in ways that medications can't. And they're very good people over there, and we're able to help fund people to get that help. And as with 2 girls that'll be in school and in college next year, it's near and dear to my heart, scholarships. Nearly $30,000 is offered in nursing and healthcare scholarships to area college students already accepted in their professional field of study. Applications are due today, so I got to get on that. So anyway, it's a lot of wonderful programs here, and now time to turn it back to Susie.
Thank you. Our plan is to get lists of those you are to call by the middle of June. Our goal today is to ensure that you're comfortable in knowing details of the projects the foundation is funding. We want everyone to feel prepared as you pick up that phone and call your list of contacts. You will notice in your folder, there is a prepared telephone script that has everything you might need to know about the foundation. About the foundation program. Sorry about that. That's not to say that you will use all this material during your phone calls, but it will be there for you to refer to as you are talking with individuals. Please don't ever hesitate to call Joan Hermes or Amanda Blaine if you have any questions. They're an excellent resource and there to help you with any questions at all that you may have. We count on each of you to review your list of names for accuracy, spelling, correct address, potential deaths that Amanda and Joan may not know about. In the case of the clubs or business division, do we have the right person listed? We really just like to be accurate when we send out the letters to each individual club or business. It is important you get back to us right away with any corrections.
So when are you going to start calling your people? Not until after the individuals have received their letters. We're currently working on getting the letters out, and we're shooting for the last week of June-ish to send the letters. So you won't need to make your calls until after the 4th of July. We will let you all know when it's time. We'll send out an email to everyone to let you know that you can go ahead. And if you don't have email, we'll call you and let you know to start making your calls. We also understand that this is a time of year that a lot of people are on vacation. So if you're on vacation when we give you the go ahead, that's totally fine. We understand. Just please make your calls as soon as you return. As our campaign goes on, either Joan or I will be sending you an email updating you on how the campaign is going. We try to do that weekly. However, sometimes we miss a week here or there. With that email, we'll include a list of all the gifts that we got that week. And so if you have anyone on your contact sheet that made a gift that week, and if you have time, we would ask for you to give them a call just to thank them and let them know that we really appreciate their support. And I think that's all I have for you. I really just wanted to say thank you to all of you, and please don't hesitate to reach out to me if you have any questions as we move along.
And I don't know if Amanda said who she was earlier. This is Amanda Blaine. She is the development officer here at the foundation and key to what we are doing. We could not raise the kinds of funds that we do without Amanda's expertise. She's an amazing person and worker. So I just want to give kudos to Amanda, and she will be, either she or I will be interacting with you throughout the campaign. I also want to emphasize the thank you aspect that Amanda referred to in the giving industry. Ever since I've been doing this, there's always been the rule of thumb that you thank a donor 7 times. You try to figure out a handwritten note, a phone call, taking them to lunch, etc., to show them your true thankfulness. So that follow-up thank you call that we are suggesting is really important. And what it does is plant that seed for the following year that, oh, they listened, they noticed, they saw that I gave, and it made a difference to them because they've reached out personally and thanked me. So that's a real key thing you can do for us. It will help us in the future. And we do have about an 85% retention rate or renewal rate, which means from last year to this coming year, we show 85% of our donors from the previous year renewed their gift. The national rate for that, the average is between 39 and 42%. So you can see we're doing very well. We're doing twice as good as the national average. So back to the slide that we have here. We're talking about all these calls and contacting people, but why are we doing it? Because we are mailing this wonderful booklet, which is created with the help of our staff and individuals, and it shows local people, which is really neat. When you're standing by the trash bin and going through your junk mail, we're hoping they don't think this is junk mail. We've got Eric here, we've got Susie. This is in your folder too, on the left-hand side in the pocket. And here's Dugan, here's his mom, Janice, here's Sarah, here's Larry and Vicky. So right off the bat, they may know that local person. This tells what we've accomplished this past year, what's ahead. And one thing we did not mention on our vision board is gathering a committee of experts in the community together to discuss if we could potentially organize an adult drop-in daycare center for our dementia patients. So that's just another big dream that we are talking about. Susie here talks about her story with her family. Everybody that's helping with the leadership has a story of dementia. So we have Eric's story. And then Eric talked about Beth Sturck, our dementia navigator. She also has a dementia story with her family. Here are 4 women, and there was that fact that Eric talked about, that 2/3 of dementia patients are women. So we had 4 in this past year that passed, and the families presented memorials to us, to the Dementia Project. This is the listing of the 15 projects that we're funding. And then sometimes people talk about, well, what can $10 give, or 100, or 150, or 250? Here are concrete examples using those dollars to tell people, well, if you gave $10, you could help us buy a book on dementia. We currently have less than 100, but we're continuing to order books on dementia, that whenever we have an event or Beth feels a family needs it, they can choose from our library of dementia books. We started this last year and we'll continue to do that. $1,000 affords therapy sessions for 10 patients through our Ways to Wellness program. So these are real concrete examples of what you can tell the people you're speaking with about how their gift directly impacts our people. Here are Larry and Vicky and their story, and Sarah with her story, and Janice and Dugan. And then these two, in Larry's talk, he talked about Ways to Wellness and the Pediatric Mental Health Service. These break down those 2 programs in a few more details because they're also about brain health, emotional health. So these 3 programs together with the Dementia Project, they are all focused on reducing trauma for our families. And then on the back is the nuts and bolts. How do we get a hold of our office, and how do you give? So this is a really important piece to make sure that they saw it in the mailing. This is the pledge card that came with it, front and back, on how to fill in and choose the amount of the gift and the credit card. We do not sell donor names. We do not sell lists. So if anyone asks that, rest assured we do not. This is a sample of the envelope that will come, and maybe that's all they ever saw. Maybe it got thrown in their bill pile and that's all that it is. So if you can be descriptive that, well, it was that purple and white envelope with the Memories Matter Too on it. Do you remember that? It was local. And then inside there's stationery that the letter will be on, and each of your divisions, community, business, clubs, and medical, each of the division chairs will have their request for the donor to renew or to consider making a gift, and will be signed. So those are the pieces of the mailing that are coming. And it's kind of a hodgepodge, as you know, for those of you who have done this before. For our new members of the committee, you need to keep trying, and you don't want to overdo when you're calling someone. If you end up leaving 3 messages, that's enough. You can tell them that they're free to call you back, or we'll just let it be after 3 times. We just kind of wait and see if they respond. But in your packet, in the very left side, oops, I took it out already. The left pocket is the telephone script, which repeats a good deal of what we have shared with you today. This is a wonderful piece to have sitting in front of you, along with the program sheet that talks about all our programs and our contact people, as well as the booklet, of course. And that way, depending on your knowledge of the person you're calling, if they make a remark, you can pick up on that and look quickly at your information, and maybe you can share, well, they talked about the dogs. Here's what I know about the dog therapy program. Or maybe they talked about the dementia project. Then you can look at that section and have some information to share. But at the beginning of your conversation, always identify yourself, whether you're talking with them in person or you're leaving a message. Say, I'm Joan Hermes. I'm a local volunteer from Sterling, and I'm calling in behalf of the CGH Health Foundation, which I greatly support. And I am a donor myself. And the reason for my call is to ask you to consider either renewing your gift or becoming a donor. And we'll let you know on your sheet. And many of you won't even know what that person has given. Our community division, we do not share that information. Our medical division, we do not share that information. With our clubs division and our businesses, it's kind of essential that we share that with you so you can talk to them. But the other 2, we do not share that. So if they do ask you about it, you can say, I will have Joan or Amanda contact you and give you an update on what your giving has been. As far as the phone calls, we all know people are more and more getting rid of their landlines. If you find out that a landline that we have given you has been dismissed, please let us know that. We will attempt to find a new cell phone to replace that. That's not always the easiest thing to do. While you're on the phone with someone, if you could ask them, if you're talking to them on a landline, if they would mind sharing their cell phone, this is your comfort level. Talk to them about how in the future it would be far easier to connect with them, as well as an email, if they would consider sharing an email. We love to send out our newsletters and other tidbits of information to share, and especially with the Dementia Project, so many wonderful things that we can let people know about if they would help us with that. So that's another important piece. Maybe a negative aspect of these calls, and some of you will get feedback. People love to tell you their dissatisfaction, and it isn't necessarily about the foundation. It may be about their most recent visit to the hospital or to a clinic or over a bill that they've received. So all I ask you to do is listen. You don't have to provide answers. You can say, I know someone who can help you with that, and just be attentive and tell them that Joan Hermes will give them a call. And then I can go forward with whatever the issue is. But undoubtedly, you will be a depository for some comments that people have been dying to share and just didn't have the person to do it. So I'm sorry beforehand if you're the object of some dissatisfaction. That may happen. Another thing, oh, great. I was going to tell you. So the first phase of the thank yous Amanda mentioned, we will be sending our letters out the end of June-ish. We will give you the signal, the green light, that it's okay to call sometime after the 4th of July holiday. Doing the calls immediately after they get the letter in the mail is the best scenario, that's primo. But we understand you may be on vacation for 2 weeks. It's okay. This is working it through your personal life. We are so grateful that you are helping us. And obviously, we're successful no matter what in all these past years, whether you're on vacation or you're ill, you've had a death in the family, whatever it is happening, your family life is your priority. We're part of a priority at the time, but we totally understand. We are very grateful for whenever you can make that calls. The best possible scenario is to do it as soon as we know the letters are in-house. And that's a whole nother issue we were talking about today with mailings. Our post office is not quite as reliable as it used to be. I think all of us are aware of that. So even though we might allow for 7 to 10 days for those local letters to get here, they may take 2-3 weeks. And the person may say, well, I never got that letter. If they did, we will be happy to drop off a new packet with them. So please let us know about that. Okay.
Right? I'm so grateful to those of you who have assisted before and our newbies who agreed to come on board this year. Our success in last year's campaign should be a great springboard for a higher goal this year. If you know of others who might want to donate, please share their name with us. If you know of other volunteers who may make some phone calls, please share their name with us. Joan and Amanda will be happy to meet with you further if you would like more information to prepare yourself for making your calls. Special thanks to our division chairs for their leadership and to all of you for joining in our Zoom training today. We'll be in touch. Thanks so much for your gift of time and commitment. It is sincerely appreciated. Thank you, everyone.
And before we leave, please let us know any questions either right now or email us or give us a call if you have any concerns or you just didn't quite understand anything. We can meet with you one-on-one, have you come in the office, have a phone call. And when we do provide the contact list to you in the next couple weeks, your immediate attention is asked if you're able, if you're around, not on vacation, etc. Because before we send those final letters out, we want your feedback, like Amanda mentioned. If someone is deceased that happens to be on your list, we need to know that. That's the worst thing possible, to send a letter to a widower who is grieving that has lost a spouse. We also want to know if they've moved to a new location. Perhaps a couple has become divorced and we're not aware of that. And especially with clubs and business, if the correct person is listed as that contact. So we make sure that letter says Dear Sam and not Dear John. So it looks like we've done our homework and you're part of that. So your response on that would be great. We typically send Excel spreadsheets through email. And if we will also provide a hard copy to you, but the quickest way to get that information to you is through email. So please, any questions you have today, let me hear it. Otherwise, give us a call or email. Anybody?
Hey, Joan,
Yes.
if I might interject something real quickly. You mentioned people are dissatisfied about some things, and paying income tax might be a priority on their list for objections. A lot of people don't know with the new standard deduction, we don't get to get a tax benefit, if you will, for contributions of this nature to the foundation. But for individuals who are over age 70 and a half, they can take money directly from a retirement program and give it to an institution, and it does not go through the income tax obligation ringer for that individual. So it's a pass-through. So instead of taking out a deduction, paying tax, and then not being able to, I shouldn't say taking out a deduction, taking money out of a retirement program and then thinking you're going to get a tax deduction for it, only to have it backfire.
Right.
This is a way to bypass that.
That's important information, and we do try to share that, but I'm glad you
Okay,
brought that up again. That's really important. More and more people are doing the required minimum distribution, or what's the other one? The RMD and the charitable, the CD.
yeah, it's a
two
charitable distribution.
Yes, required charitable distribution. So if you have any questions about that, I can provide information on that. And we can also refer you to Larry. He's an expert on it. Anybody else? All right, well,